Once again, this is Dr. Hatem Eleishi from Dr. Hatem Eleishi Medical Center in Cairo, Egypt. This video is about cortisone. Where does it stand in the management of the patient of an autoimmune rheumatic disease? Cortisone medications are very powerful anti-inflammation medications. They are a type of steroids, but not the same type of steroids that some athletes are using. They can be used as oral tablets, they can be used as injections and infusions, and they can also be used as intra-articular injections. We will deal here with cortisones in two different settings. Autoimmune rheumatic diseases where we are managing the problem of arthritis in particular, and autoimmune rheumatic diseases where we are managing problems of other organs in particular. We start with the joints. You remember the prostaglandins? Prostaglandins are the inflammation molecules that are produced when the joints are attacked by antibodies, and those prostaglandins are responsible for the ongoing inflammation in the joint, the symptoms, pain, swelling, stiffness, and inability to use the joint. You can refer to the video titled Types of Medications Used in the Patient with an Autoimmune Rheumatic Disease. This is where we started to talk about prostaglandins and how we can inhibit them. So, prostaglandins are inhibited by NSAIDs, we mentioned them in a previous video, and by cortisone. Just like NSAIDs, cortisones can be used to manage the symptoms of an autoimmune arthritis on a short-term basis until DMARD action starts. They can be used here as tablets or maybe injections. We call this approach the bridge approach. What do we mean by bridge? We have an active disease, DMARDs kick in after 8 weeks, so we prescribe cortisone as a bridge to cover those 8 weeks, 4 to 6 to 8 weeks. And after that, when the patient has a disease that is more under control with the DMARDs, we start to taper the cortisone doses gradually. We can also use them as a local intra-articular cortisone injection. If you have a patient with an arthritis that is mostly controlled, you only have 1 or 2 joints that are still active, instead of changing the doses of the DMARDs, the big treatment plan, you can just make a local injection in that 1 or 2 joints, that's all. So we use it as some kind of a push to a patient who is almost under control, but you just need 1 or 2 joints to be under control also. In all cases, cortisones are not part of the regular long-term treatment plan of autoimmune joint inflammation, autoimmune arthritis, except very rarely, in which case we use them in a very small dose. How about cortisones in the management of an autoimmune rheumatic disease where other organs are involved? Here we mostly refer to the lung, kidney, and blood vessels in particular. Cortisone medications might play a very, very important role at the initiation of treatment where they are prescribed at high doses and for weeks before their doses are either gradually decreased to stable lower doses or to complete tapering later on. As cortisone medications are being decreased, other DMARDs, non-biological or biological, are introduced in the treatment plan.